I think one of the most satisfying things in emergency and trauma surgery is making a difference in patients' lives and seeing patients that may be very close to dying, but it's the efforts of a team that gets them through it, and how grateful the patients and their families are.
My name is Pat Nicolato. I'm one of the cardiac surgeons here at VCU. I was involved in a very high-risk case that was turned down by a couple of services in the community. So he's a patient that's well known to me. I've operated on him before several years ago, and in his particular case, there was an IVC injury, and that was not recognized till the end of the case. When we did recognize it, we did an emergent consult to the trauma service, and Dr. Anand showed up immediately.
Yeah, I'm Rahul Anand. I'm professor of surgery here at VCU and also the program director for the general surgery residency. Well, we were asked to respond emergently to Dr. Nicolato's operating room. They were doing a coronary artery bypass grafting. The patient was on bypass, and they were having a hard time getting the patient off of bypass. And the suspicion in the OR was that there was potentially bleeding in the abdomen. When I knew what type of injury we were dealing with, and it was the middle of the day here at VCU, there's plenty of resources, I elected to call my partner, Dr. Rodas, to the operating room to see if he could come and help.
Yeah, my name is Rodas. I'm one of the trauma surgeons and acute care surgeons here at VCU. Sure, I was called by Dr. Anand to the operating room of cardiothoracic team. And when I showed up in the operating room, Dr. Anand communicated with me he suspected where the bleeding was coming from, so I scrubbed in, and similar to any sport, when you have any team sport, the communication is really important, and knowing how to communicate and how to act together as a team is very important.
I think collaboration is a major part of VCU. I think Dr. Nicolato, first of all, knew that we have a responsive emergency general surgery team, and that's why she called us. I knew that I have responsive partners, and that's why I felt comfortable communicating with Dr. Rodas. And all the while, we are collaborating with our anesthesia colleagues and the nursing staff in the room to make sure that the patient gets the best care.
Well, I ran into Dr. Nicolato a couple times in the hallways, and she had mentioned that she had seen the patient in follow-up, and the patient was doing great. They were very grateful, and it's a happy outcome.